Okay, so we can start. So diabetes is a growing problem globally, and up to 50% of individuals living. Yes?
Yeah, continue.
Okay, because I think it's playback, that's why, okay. Yeah, so diabetes is a growing problem globally, and up to 50% of individuals living with diabetes suffer from peripheral neuropathy. So if the protective sensation is compromised, there's an increased risk of ulceration in these patients. Now, research shows that even though ulcers develop on high plantar pressure areas, an increase in plantar pressure on its own does not lead to ulceration. So it is important to understand more clearly which underlying biomechanical factors are causing that increase in plantar pressure in neuropathy. As we all know, ulceration and having to undergo surgery for amputation is very debilitating for patients. It is not ideal to just offload the ulcerative site when treating an ulcer. It is important that we also understand how lower limb function influences the redistribution of plantar pressure in the presence of neuropathy. So through this review, it is aimed that the underlying mechanism of the increase in plantar pressure resulting in ulceration is found, so that more patient-specific treatment options can be provided, therefore speeding up healing and preventing ulceration with amputation. The outcome measures analyzed in this review were joint kinematics, kinetics, spatiotemporal parameters, muscle activity, and plantar pressure. So this review was conducted using PRISMA guidelines, and after filtering results according to the inclusion and exclusion criteria formulated, we ended up including 16 studies in this review, where 12 studies were included during meta-analysis. The Downs and Black tool was used to perform a quality assessment of the included studies, where half of the studies scored as being of good quality, whilst the rest scored as being of fair quality. There were problems with internal and external validity, since most studies did not provide information as to whether participants were representative of the whole population or if they were recruited from the same population. Another problem that most studies was that most studies only partially address any confounding variable, especially when it comes to excluding peripheral arterial disease. Both a qualitative and a quantitative analysis was performed in this review, and all of these statistical tests seen here were performed on all of the outcome measures being tested in 12 out of the 16 studies. The results show significantly lower knee, ankle, and rear foot kinematics were found in the neuropathic groups. Also, significantly higher peak plantar pressures and pressure time integrals were found in most of the foot regions. However, no significant difference was found in the hip, midfoot, and forefoot joint kinematics, muscle activity, joint kinetics, and spatiotemporal parameters. However, high heterogeneity was found between studies in most of the outcome measures assessed. This could be due to their small sample sizes, the quality of addressing certain confounding variables, and also the use of different tools and protocols used during data collection, which might have affected repeatability, as mentioned by Fernanda's stories, in fact. If you use different tools and protocols, it would affect repeatability. Now, when it comes to neuropathic ulceration, the first MTJ is a region of interest, where even though results from all studies have shown decreased joint kinematics in the presence of neuropathy, only half of the studies stated that there was actual significant difference from the control groups. Further research is required, including larger sample sizes and also analyzing the relationship with other foot joint segments, because there is lack of research when it comes to analyzing the effect of other joint kinematics in the presence of neuropathy. In continuance to this, we're investigating the second vertical ground reaction force peak, that is during toe-off. All studies have shown a decrease in forces acting on the forefoot. This is contradictory, given that higher plantar pressures and pressure time integrals were found through the forefoot. So further investigations are required, analyzing the correlation between ground reaction forces and plantar pressures in neuropathy. So from the results gathered in this review, it can be hypothesized that due to diabetic peripheral neuropathy, there may be decreased knee and ankle range of motion, resulting in reduced dorsiflexion of the foot during heel strike, which results increased peak plantar pressures during gait, therefore increasing the risk for ulceration. So even though research has shown certain significant changes in lower limb biomechanical patterns in the presence of neuropathy, there was high heterogeneity between studies. So further research is required to be able to add to the body of knowledge, be able to identify the underlying mechanism of ulceration in the presence of neuropathy, in order to be able to provide more precise and patient-specific ulcer prevention and management strategies. So this is my reference list, and thank you.